Hello, I'm Dr. Prasanth Pillai. I'm back with a very important topic today. It is pertaining to impacted wisdom teeth. Impacted wisdom teeth are conditions which we encounter in our day-to-day practice on a regular basis. So I thought it was important for me to make a video on this and share all the relevant information with you all, and hence this video. So what are impacted teeth? Impacted teeth are those teeth which are locked inside bone because they are prevented from eruption for various reasons. So very often impacted teeth are detected only in a routine dental examination. You don't really, the patient does not report with a problem in relation to impacted teeth, but very often they are noticed in the routine examinations, especially when we make a routine checkup x-ray. That's when you realize that there are impacted teeth there. Now in this particular x-ray you can see there are five teeth which are impacted. One is the canine tooth out here, and then you can also see all the 4 wisdom teeth which are impacted. So now which are the commonly impacted teeth? The commonly impacted teeth are the mandibular third molar, the maxillary third molar, the maxillary canine, the mandibular premolars, maxillary premolars, mandibular canine, maxillary central incisor, maxillary lateral incisor. These are the commonly impacted teeth. Now in this particular x-ray you can see that this particular patient has got impacted lower wisdom teeth as well as almost 6 teeth impacted in the lower jaw from the canine to the premolar on both sides. You can see that, it's very clear. So in such situations the patient has no teeth in this area and we have to do a major surgical procedure to remove these teeth, and then we have to do some orthodontic alignment and then later take this patient up for replacement of the missing teeth. That is how it is. Now, what are the causes for impaction? The causes may be localized, some kind of obstruction to eruption, lack of space for eruption, ankylosis, that is the tooth tends to fuse with the bone, and therefore the bone because of the fusion it is unable to move out and erupt into the oral cavity. Ectopic position of the tooth bud, dilaceration of roots. Now these are all conditions which are difficult to explain in detail, and it is not relevant here, but I just thought I'll just give you an idea about what are the causes. And then you also have systemic causes which are hereditary. Many people have got this running in families. The parents and grandparents, they all have impacted teeth, and that gets passed on to the succeeding generations. It can happen because of various conditions after birth like TB, tuberculosis, rickets, malnutrition, etc. It can occur in endocrinal disorders like thyroid disorders, parathyroid and pituitary gland disorders, hereditary disorders like cleft palate, osteoporosis, etc. All these are all associated with impacted teeth. Now, all permanent teeth erupt. Now, let's talk about wisdom teeth. Now, of the impacted teeth, I need to talk about wisdom teeth now. All permanent teeth erupt by the age of 12 years except the third molars. By the time the third molars erupt, very often the space for accommodating teeth in the jawbone would have been taken up by the 28 permanent teeth which have already erupted. Thus, they tend to get locked inside, unable to come out into the mouth. Many of them manage to squeeze through and come to position themselves in abnormal postures, which turns out to be problematic later. So, why is there lack of space for eruption? Now, you need to know, why is there lack of space for eruption? Now, we are supposed to have evolved from apes. For those of us who follow science very intently, we know that evolution is something which is happening among all living beings on the planet, including humans. So we are supposed to have evolved from apes. Humans, that is the species called the Homo sapiens, we are supposed to have evolved from apes. So when you look at the skeleton of the ape, you see that the jaws are very prominent, the skull is relatively smaller in comparison, and the jaws are very prominent, and they've got full complement of teeth. And whenever the ape chews, he is able to bite into all kinds of food with a lot of pressure. And mind you, apes do not cook their food, so they have to eat raw food very often. So the teeth have got to be geared to take up all those forces. But as one group of apes evolved to become humans, what happened was the job of the jaw reduced considerably, and the jaws started shrinking in size. So you can see this image. On the left side, you see the ape's jaw and the skull, the cranium, and the human jaw and the cranium. So they say that the brain case is expanding at the expense of the jaws. The jaw is shrinking in size. Why? Because the load on the jaws are coming down considerably because of the increasingly soft diet we people are having these days, and the less amount of force which the jaws need to apply for chewing, efficient chewing, and therefore the jaws shrink in size. But the brain case is expanding because automatically, just because we are using our brains excessively. So automatically the brain case expands, but the jaw shrinks. But as the jaw shrinks, it does not have sufficient space to accommodate all the 32 teeth. So generally what happens, by the age of 13 to 14, 28 teeth erupt into the mouth, and the last teeth to come into the mouth are the wisdom teeth. By the age of 14, the jaw growth stops. 14 to 15, major jaw growth stops, and there is very minimal jaw growth up to the age of 20. So what happens once the major jaw growth stops, then there is absolutely no provision for the wisdom teeth to come out, because they are coming in after the age of 15. And before the age of 15, whatever little space is available would have been taken up by the remaining 28, and that they will deprive the wisdom teeth of the space for them to come and accommodate themselves. So this is what happens now. These are the types of impaction of wisdom teeth. In the lower jaw, you can see how in different angulations you can see how the teeth are positioned, and these are the angulations in which the upper wisdom teeth are seen, again because of lack of space for eruption. And now let's see, there are a host of problems which are associated with the wisdom teeth. Now please remember, as I mentioned earlier, you either have wisdom teeth which do not create any problem at all, or you have wisdom teeth creating problems of varied kinds to extremely complicated problems. So let's see what are the problems which are associated with wisdom teeth. Yeah. Now in this case, you can see the wisdom teeth is lying at an angle, and this tooth, the upper wisdom tooth, is in its position, and there is a big gap here, and because of this particular angulation, the gum tissue which covers the wisdom teeth is here, and whenever the patient chews, automatically the gums get inflamed, it gets traumatized and it gets inflamed, and this condition is what we call pericoronitis. Pericoronitis. Please remember, it has nothing to do with COVID disease, it has nothing to do with coronavirus. Corona means crown, and pericorona means something covering the crown, outside the crown. So this is the tooth crown, the wisdom tooth crown, and this is the pericoronal tissue, that is the tissue which covers the crown, and this has got inflamed, and that is why it is called pericoronitis. Now this is the beginning, pericoronitis. The next thing, now you can see this is a depiction of pericoronitis, how the gums get inflamed, and these are the photos of a 28-year-old girl whom I treated more than 15 years ago. She reported to me with very severe pain in relation to her jaws, and she was unable to chew properly, and she looked very emaciated just because she had not eaten properly. She was referred to me by a very good friend, a physician, and the physician told me that she was under treatment for a host of things, including mental depression and Crohn's disease, which is a condition affecting the gastrointestinal system, and a lot of other things. But and the patient was extremely weak. So the patient was referred to me for a dental opinion. We took the orthopantomogram, the full mouth X-ray. When we realized that the wisdom teeth were impacted, they were locked inside. And I informed the physician that most likely this is the problem which is creating such a lot of issues for the patient, including the multiple oral ulcers, the difficulty in opening the mouth, the gastric irritation, and the emaciation. All this would have been contributed by the wisdom teeth. So the physician allowed me to proceed and to remove the wisdom teeth. We removed those teeth, and she turned back extremely healthy and happy. So this was mind you, she was a divorcee because she had this problem with the wisdom teeth, and the people back home, they thought that she suffered from some dangerous condition, and that caused a lot of marital strain, and she got divorced after that. But later, once the wisdom teeth were removed, she got a new lease of life and she got married again. She's very well settled, and I feel so happy to see her when she reports for reviews on a regular basis. So this is that particular photograph. Just imagine the amount of trouble which a wisdom tooth creates. Now, this is the second point. You get food impaction between the impacted tooth and the adjacent tooth, and the green color thing here is the food, is a depiction of the food getting impacted, and because of the food impaction, the food allows colonization of bacteria. The bacteria eat into the enamel on the wisdom tooth as well as the adjacent tooth placed there, and this cavity can lead to a lot of problem. And later what happens, decay sets in, and later this is what happens. The upper wisdom tooth, because it has not contacted the lower wisdom tooth, it starts migrating down. It is what we call supra-eruption. So the moment the upper wisdom tooth migrates down, there is a space left between the wisdom tooth and the preceding second molar where food gets trapped, and then that leads to more problems here at the neck. So one problem leads to another. It's a cascading set of events, and you can see this is the situation after a patient got her lower wisdom tooth removed, and she was insisting that her upper wisdom need not be removed, and that the upper wisdom can be removed when it creates a problem. She came to me after about 5 years with this particular problem, when the upper wisdom had started migrating and it had started creating, it was hitting on the lower gum, and there was also food getting trapped in between. So all these problems can be avoided when we remove the wisdoms on one side simultaneously. Here is another picture of a impacted wisdom tooth, the upper wisdom tooth which is impacted, which is impinging on the adjacent second molar, and it has caused a lot of infection here, and we need to surgically remove this tooth and then do a root canal on this. Only then can the problem be solved. Now, what happens after the decay? The decay spreads into the adjacent tooth surface, and gradually it enters the pulp. The pulp is the living portion of the tooth, and from here the infection spreads down through the root canal, and it creates an infection at the root tip, which we call the root apex, and this is when the patient experiences very severe pain. Now, this picture shows how this lady, a patient of mine, got severe pain on the second molar because of the third molar, which is malpositioned, and she had to undergo a root canal of that particular tooth, the second molar, and later she had to undergo the wisdom tooth removal. So this is a common problem which we encounter in our day-to-day practice. Here is another depiction of a very similar situation. You can see the decay on the back side of the second molar, and the front portion of the third molar is completely decayed. Now, here is another slide showing the various problems in relation to wisdom teeth. The wisdom tooth which is impacted causes a decay on the adjacent tooth. It causes migration of the upper tooth downward, because of which food starts getting trapped, and this affects the adjacent teeth. So this particular patient, who came to me after about 5 years after the first initial consultation, when only this particular tooth was involved, when he came back after 5 years, he was saying he was in severe pain and that a local doctor advised removal of 5 teeth. So he wasn't sure, so he came back to me. And when I took the x-ray, this was the picture, and I told him that I would rather agree with your doctor there back home because all the 5 needs to go. And I had to remove all the 5 for him. Now, what are the other problems which are associated with wisdom teeth? This is a cyst. Very rarely a cyst can develop in relation to the roots of the wisdom teeth, and this cyst can compress the nerve which is running underneath. And this is another picture of the cyst. You can see how huge the cysts are. All these things may not be noticed until you report to the doctor with a problem. This is why we always insist that every patient should undergo a dental checkup and a routine dental checkup once in 6 months, so that you are able to rule out possible problems and initiate treatment well beforehand, if at all you find a problem. Now, this is the situation with the uncontrolled wisdom tooth infection which is spread to the face, and this is what we call cellulitis, which is a big swelling on the face associated with the infection. So in such situations, very often we have to admit patients, and we have to put them on IV intravenous antibiotics to control the infection before we declare the patient fit for normal activities. And we'll also have to remove the wisdom teeth without much delay. Wisdom teeth also create a lot of headaches. Many people have complained of headaches and earaches because the wisdom tooth is lying very close to the ear and the head in general. So automatically, patients develop headaches and earaches. This is an X-ray depicting the problems which a wisdom tooth can create. You can see this. There is a lot of vertical bone loss in relation to the second molar. And the wisdom tooth, the culprit is remaining there stable without any problem. Something very similar on the right side also, where the second molar is infected and the upper molar had to be extracted. Another image of impacted wisdom teeth. You can see how they position themselves in the jaw. This is a complication of surgical removal. Very rarely, very rarely, a fracture of the mandible can happen because of certain kinds of weakness within the bone, or because of the nature of the surgery which is required to remove the wisdom. So the older the individual, the greater the chances for a fracture like this. And we get wisdom teeth in bizarre presentations in different ways, as you can see in these images. So many different ways they lie inside the jaw bones. Now, there is a treatment modality called prophylactic odontectomy, which is generally done in children of growing age, where we are able to predict that the wisdom teeth are going to get impacted. So in such a situation, we prefer to remove the wisdom teeth well beforehand. And this procedure is called prophylactic odontectomy. You can see the wisdoms are here. And this is the situation when the child has reached a certain age beyond 16, but the wisdoms are there and they don't have enough space to erupt, and therefore we do this particular procedure then and there, so that you avoid a very complex removal later. This is the X-ray of a wisdom tooth being sectioned out, pre-operative and intraoperative X-ray. And this is the post-operative, after removal of the wisdom tooth. Yeah, that's the post-operative. And these are very complex cases of surgical removal of wisdom teeth. Here is another image of a patient of mine who reported with pain in relation to the right upper and lower molar, the wisdom teeth. And you can see the cavity here. We had to remove this, and we've started root canal treatment on this particular tooth. And mind you, this wisdom tooth is also migrating down because it has no counterpart in the opposing jaw. Here is another X-ray, a very similar X-ray here. Now, I've also got to mention about the nerve in relation to the wisdom tooth. There's a nerve which runs down from the cranium through a small orifice called the foramen ovale. The mandibular nerve comes down and then it runs after branching out in the lower jaw. One branch goes to the tongue, the other branch goes to the cheek, and there are a few other branches coming out of the main bundle as soon as it exits from the cranium. Now, what is the relevance of the nerve in relation to the wisdom teeth? Generally, one nerve called the inferior alveolar nerve comes down like this, and this very often lies below the roots, but there are situations where the roots can loop around the nerve, as you can see in this image. So here is another depiction of a similar situation, and you need to understand what you need to get done in case there is a looping of the nerve in relation to the wisdom tooth root. So we doctors, we've got so many methodologies to identify such teeth, but however we always make a imaging done called CBCT, which gives us a three-dimensional picture of the impacted tooth as well as the nerve, so that we are able to take enough precautions while we do the surgery. And there are also situations, now this is another depiction of the 3D imaging of a particular patient who came with the nerve in close relation to the wisdom tooth. So we had to section this tooth out carefully without injuring the nerve. You can see this, again the nerve involvement can be seen. So what we've done, we have just sectioned out the tooth crown, and we've just left the roots there, and the roots will gradually heal, and you can see how the patient looks after a year. The extraction socket is closed completely. You can see the difference. Here the extraction socket is completely closed and there is nothing left behind, and there is just the root fragment left behind, and this root fragment does not really create any problem. Rarely it gets pushed out, and in such a situation it will disentangle from the nerve, and it's much easier for us to remove it once it gets pushed out by the normal body tissues. Now here is another depiction of a patient who came with curved roots, and we decided that we'll just section the crown out. So we sectioned the crown out and we retained the root there, just to avoid post-operative difficulties for the patient. So again, please remember, wisdom teeth are also associated with crowding of teeth, because as I mentioned earlier, the wisdom teeth come into the mouth in the end, and because they have lack of space for eruption, they tend to push the other teeth from behind, and this causes crowding. So very often in patients who've undergone orthodontics, in order to prevent relapse, that is prevent the patient from going back to the original position, we had to remove wisdom teeth prophylactically, that is to prevent a further complication. Now, another very important question which patients have asked is, will the cheeks collapse after the wisdom tooth surgery? Well, see what happens in a wisdom tooth surgery, the wisdom tooth is positioned very well inside bone, and out here there is no bone. In the up to the second molar there is not much of bone, but from the in the second molar distal end and the third molar you have sufficient bone, and therefore because there is sufficient bone, there is no question of a collapse of the cheek, which does not happen. Even if it happens, it rarely happens when the patient has got an unfavorable bony anatomy in that area. Now, is it essential to remove all impacted wisdom teeth? It is not essential. Now, as I mentioned to you earlier, there are considerable number of people who do not present with any kind of symptom. The wisdom teeth are identified only in an X-ray or in a CBCT. Until then, the patient is not aware, the doctor is also not aware. So in such situations, it's not necessary for us to intervene, because you are likely to create more problem by removing such wisdom teeth which are deeply placed. Now, if they are creating problems, well, yes, you have to treat the problem and then remove the tooth and ensure that once the tooth is removed, then you are ensuring that there is no more disease coming in that particular area. So only in such situations do we extract wisdom teeth. Wherever there is a problem, when there is no problem, we do not extract wisdom teeth. We just leave it for observation. It's important that we observe these wisdom teeth to ensure that they don't develop anything abnormal in relation to the wisdom teeth, say like a cystic lesion or a cancerous growth or something like that. So generally we make this X-ray as a baseline and we provide this to the patient, and we request the patient to report back once in a year or once in a year and a half to repeat the X-ray to confirm that everything is normal. But in case we see something unfavorable developing in relation to the wisdom teeth, we have to remove them. Now, you also have canine impactions. You can see the canine teeth are impacted here, and we routinely perform surgery for the canine, for impacted canines also. And there are situations when we have to use, there are situations when we do not remove canines, but we pull them down with the help of a particular orthodontic appliance and then pull them into position after creating space there. So here is the picture of an impacted canine. That's an animation of an impacted canine. This imaging is called the CBCT imaging, where you can clearly see the three-dimensional picture of all those teeth in that area. Now, what are the post-operative instructions after wisdom tooth surgery? So I'm coming to the last part of the program of the video. The most common complications or the most common difficulties which are encountered by patients after the wisdom tooth surgery are pain and swelling. So we always insist on patients having the full course of medication, whether it be antibiotics or anti-inflammatory tablets or analgesics, which we normally put on, so that you avoid the pain and swelling, which is very, very important. And we always advise use of cold compresses, so that that helps in reducing the pain and swelling in a big way. The other possibilities are trismus, that is restriction in mouth opening, numbness of the lips or tongue, and on the affected side, a void may be felt, a large defect may be felt at the area of the surgery site, but you don't have to bother. Please don't feel that area with your finger or your tongue, which is very important. And you can also have cracked corners of the mouth. The corners of the mouth can be cracked, and because of the surgical, the amount of force we apply with various instruments along the corner of the lip, this is a very rare problem which occurs. All you need to do is just apply some Vaseline in the corner of the lip to ensure that the area becomes less problematic. And some patients report with elevated temperature, and very rarely you can see bruising of the skin outside. This happens mainly in elderly patients. You see some reddish bruising of the skin, and the patient is supposed to drink plenty of water, plenty of fluids, which is very important. They have to avoid smoking and avoid strenuous activity like exercises and things like that. And they've also got to use regular use of mouthwashes, whatever has been prescribed by the doctor. Natural mouthwash is your warm saline, which can be used. And the diet part, you have to use very soft diet. Never go for hard on hot and sticky diet, which is very important. And coming to healing, the healing is variable. In some people the healing is very fast, and in some people the healing can get delayed. And healing is also dependent on the extent of the injury which is developed after the surgery. In some situations there will be a large open wound. So if there is a large open wound, automatically the healing will be a little delayed. And I think I've covered most of the points pertaining to wisdom teeth. If there are any queries, please feel free to email us. If you've liked the video, please press the like button and also press the bell button, and please share this video with your friends. Thank you very much.